Nutrition and gastric bypass surgery. Why a team effort is necessary. Although it might surprise many people, bariatric surgery has been performed since the 1950s, although not in the numbers of today. The number of children, teens and adults who are overweight or obese has more than tripled in recent years, leading to a virtual explosion of weight loss surgeries being performed. The cost of the surgery itself can vary from $10,000 to $30,000, depending on the type. Recovery time also varies depending on a number of factors, including the type of surgery, individual healing time, and compliance with post-operative orders. The most common of the weight loss surgery types is the Roux-en-Y gastric bypass, which creates a small pouch from the stomach by stapling half of this organ closed and reconnecting it to a lower portion of the small intestine. Not only does this mean that only a smaller portion of food can be eaten, it also means that a smaller portion of the foods that are eaten will be absorbed by the body. Every bite of food must count so that nutritional deficiencies do not develop. However, there are many that are common depending on the type of surgery. For instance, with the Roux-en-Y gastric bypass, iron, vitamin B12, vitamin D and calcium deficiencies are common, while with biliopancreatic diversion surgeries, it is protein and fat-soluble vitamins that are deficient instead. In any surgical type, those who have frequent vomiting may have thiamine deficiencies as well. This is one of the reasons that a team effort is needed to keep weight loss moving in the right direction and to keep the patient healthy at the same time. There are quite a few rules and adjustments that have to be carefully followed for the surgery and afterward. Behavioral modification and support might be necessary, especially in those who have been making poor food choices or have had issues with portion control in the past. In the first few weeks after surgery, the stomach is recovering from the trauma of the surgery. During this time, your diet will be entirely liquid so that the healing can be completed before the stomach is called into work for the digestion process. During the phases of post-operative care, the patient will have to pay careful attention to what they are eating as well as how they are eating it. When soft foods are allowed, it will be important to eat slowly and to chew thoroughly and to pay careful attention to the amounts that are ingested. At no time will the patient be able to eat more than 4 to 6 ounces of food, although consistently eating too much food will cause the stomach pouch to stretch out quite a bit. If you do not follow these guidelines, you will have severe pain and vomiting, which again can lead to even more serious deficiencies. The typical meal consists of food and a beverage on the side. However, after weight loss surgery, the two will not be able to be consumed at the same time. It is important that you understand that the stomach pouch will only hold a few ounces at a time, so your beverages will be consumed either before the meal or after. This is also true of medications, which will have to be adjusted so that you are not trying to take them during a meal. Your doctor will give you suggestions on how to take your medications properly, especially those that are suggested as being taken with meals. With all surgery types, the need for supplements is important, including protein and vitamin supplements. For the lap band surgery, the second phase requires 2 ounces of a protein supplement every 2 hours while awake so that you are assured of getting enough of this vital nutrient. There are several options, including using ProfectR, a protein supplement from Protica. Available in a number of sizes, including a single serving size which is less than 3 fluid ounces total. It gives a full 25 grams of protein with 100 calories per serving and comes in a number of different fruit-based flavors. Working with a nutritionist or dietitian, the surgeon will send most patients to a licensed nutritionist or dietitian even before the surgery is completed so that the diet and food amounts can be discussed. It is vitally important that the patient understand what is expected of them, especially in those surgical types that will not include frequent follow-up visits. Some surgery types require adjustments in the doctor's office, which will include weigh-ins and consultations and can keep some patients on track because they are more accountable. On the other hand, with other surgery types, weight loss is virtually automatic and overeating will cause pain and vomiting, which may be enough for most people to stop. However, there are some people who will not learn and will continue to overeat despite these complications and the serious risks that come with them. Of these, the most serious is peritonitis, which is a serious infection which can quickly cause death. It is also important that the patient understand his or her own role in this process, not only so that the weight loss goal is reached but so that the best health is maintained. In addition to working with the nutritionist, there are other support groups and informational sites that should be looked into as well. Why protein is so important. The human body is made up of thousands of different types of proteins, the building blocks of a number of tissues and fibers as well as start of a number of enzymes and hormones that are used for digestion, the regulation of sleep and other functions. Protein keeps the metabolism high, which is very important for weight loss, but it also keeps the body from feeling hungry between meals, which can make the weight loss efforts easier. Protein deficiencies are dangerous, not only because they can throw off the metabolism, but because they can also throw off other systems in the body as well. If the protein is low enough in the body, it may even lead to heart irregularities and can also cause death. Protein is absorbed in the body in the upper intestine, which is closed off in many types of weight loss surgery, so the chance of being deficient is greatly increased. Using a protein supplement to keep the body healthy and strong is important, especially in the early phases after surgery when the body is healing. Protein is vital in the healing process, not only as part of the immune system, but also to help rebuild the skin and inner layers that have been cut during the surgical process. Other factors to consider: after weight loss surgery, it is important to avoid simple sugars, including candies, juices, condiments and other sauces because it may cause dumping syndrome, a condition where food moves so fast through the system that it causes serious and unpleasant symptoms. These symptoms can include shaking, sweating, dizziness, rapid heart rate and very severe diarrhea. Having diarrhea can be dangerous because it can lead to dehydration, especially in the early stages of weight loss surgery follow-up.